Nobody wakes up in the morning thinking, I'm going to go to A&E today. Nobody knows. Nobody knows who it's going to be.
Paediatric trauma call, 15 minutes.
Code red, helipad response.
You're having a heart attack.
We want to be in and out of scan in the next 10 minutes.
I can't feel any pulse.
A&E reception, can I help you? Yeah, 24 hours, 7 days a week. I love that question. What's your opening hours?
St George's, London, one of the busiest and most advanced A&E departments in the world.
Beautiful. It's as if we've done it before.
We are there when awful things happen to pick up the pieces.
We have a 2-year-old who was kicked by a horse.
We see the unpredictableness of what happens in life, and we're suddenly having to explain why it's gone wrong.
I can't feel my left leg.
You'll be okay.
A place where life
A&E selfie! Down below. Too slow.
love
Such a good boy.
So proud of you.
and loss
I'm still here.
unfold every single day.
So we don't shake hands at this hospital, we fist bump. Can I have a fist bump?
All the patients you're about to see were treated in just one 24-hour period.
Hello, darling.
You genuinely do see the best of people in this job. You'll see strangers rushing to the aid of someone they've never met. You just see things that make you realise just how important the people in your life are and the people around you are.
You've literally got like one really long hair that's sticking out from your moustache and actually down to your bottom lip. It's going down there.
Pull it out then.
Okay, you gonna let me do it?
Look at that. Like we're in A&E.
Adult priority call, 5 minutes.
Nurse Emily has just started a 12-hour shift in resus.
Who hasn't got a patient? 3 and 4, there we go. I never had a plan B. I always wanted to be a nurse. My mum and my grandma are nurses, and I used to dress up as a nurse. I used to like make all my teddies better and pierce all their ears, give them injections. I love resus, having to think on your feet. You just don't know what's going to come in the door.
Can you relax your hand for me? Thanks, Helen. So far, so good.
I think the kind of people that work in the emergency department tend to be a bit extrovert.
It's just, if that's your priority, then...
Everyone's a little bit crazy.
Oh yeah, you made it through.
Our shift patterns allow us to do a lot of travelling. You just go off with a backpack and you never know where you're going to end up. Sometimes you end up in really grimy little hostels, but I'd always prefer to stay in a cheap hostel than a 5-star hotel any day.
You right there? I'm Emily. You okay?
When trauma patients come in and there's 10 people around their bed, they can't see any of them. I think it's really important to go up to the head so they can see your face. Be like, I'm the nurse looking after you.
Just gonna put this on your mouth so you can breathe a bit better, okay?
You do have to remember that for them, it's a really traumatic event. If we can improve that, then it's one of the best things we can do.
Hello, St George's. Okay. Yeah. Yeah. With what, sorry? Yeah. Bye.
Adult priority call, 8 minutes.
A 50-year-old motorcyclist is being rushed to A&E after crashing headfirst into a lamppost. The woman was riding back from a motorbike rally with her husband when the accident happened 3 miles from their home.
So there's a trauma transfer coming in to 6.
She was taken to a local hospital, but her injuries are so severe, she's being transferred to St George's.
As soon as the red phone goes off, everyone will have a designated role. You usually have a lot of adrenaline running through your body. You prepare for the worst with high-speed motorcycle accidents. You don't have that protection of the car around you. The whole body goes through such a trauma, you don't really know what to expect. You have to think about everything.
Her husband travelled with her from the scene of the accident. As she arrives at hospital, her daughter is still to be informed.
I left work at 5:30, and on the radio it was saying about this horrific motorcycle accident that had happened down at the Meadows. And I didn't think anything of it because it was sort of 5:30 by then, and Mum and Dad should have been home by 4. I tried to ring Dad, but I couldn't get hold of them. I walked in the front door and I shouted, and nobody was here. So I went into the garage, and Dad's motorbike had literally just been abandoned in the middle of the garage. Dad religiously hangs his leathers up, but it was all just thrown on the floor in a pile. And Mum's bike wasn't there, so at that point I started to panic.
And relax. That's it.
This is Michelle, 50-year-old female, motorcyclist versus lamppost RTC. She's got fractures of C7 and T1, a right compound fractured humerus, right fractured scapula, and right rib fractures 3, 4, 5, and 6.
Hi Michelle, I'm one of the doctors for orthopaedics. I know you've got a broken bone here, and I know you've got quite a few other things going on, but I need to check you top to bottom.
When you fracture your humerus and your ribs, you're at risk of massive bleeding from these bones. And when you fracture your ribs, you're also at risk of chest injuries. You can bleed into your lungs can collapse.
So I'm gonna have a listen to your chest. Take nice deep breaths for me.
Scans from the initial hospital have revealed broken bones in her neck, arm, ribs and shoulder.
As soon as they said we're going to St George's, I remember turning around to the doctor and, why are we going to St George's? What has St George's got that Frimley doesn't? And them being, it's the trauma centre for the UK, it's the best place, it's where she needs to be. And that was kind of the point there, and it was like realisation. This is not as straightforward as you think it's going to be. There is something seriously going on.
Doctors are most concerned about the fracture in her arm, which may have caused long-term damage to the nerves in her hand.
How does that feel here?
Same.
Same.
Pins and needly. A bit like my arms numb.
When you break a big bone, especially when it's a big open fracture,
Just keep exactly still, don't move at all.
if you've burst through, your nerves and vessels are damaged. And if you lose your blood supply, you're running risk of losing the arm.
You're right.
50-year-old motorcyclist Michelle arrived in A&E after crashing headfirst into a lamppost.
What hit your arm?
I don't know. Oh.
Keep your arm still.
I'm trying. All
right.
Doctors are waiting for the full results of a CT scan to determine the extent of the damage to her left arm, which was so badly broken, the bone punctured her skin.
Motorcycle accidents, you can get pelvic injuries, you can get internal bleeding, chest injuries. It depends what they hit after they come off their motorbike. You won't know till you get a CT scan what's going on the inside as well, but you can always prepare for the worst.
Sometimes it's tempting to move it when you feel pain, but that will make the pain so much worse, darling.
We're still waiting for them to let us go in and see her. So I'll give you a ring when we know anything.
Michelle's daughter Alex and her friend Holly have joined her husband Rick at St George's.
I drove straight to the hospital. I couldn't find a parking space, but there was a little old lady that was doing her front garden, and I was completely crying my eyes out. And I said, "Mum's been in a motorbike accident. I need to get to the hospital. Can I park here?" And she said it's fine. And I ran, and I nearly got hit by a car on the way into the hospital because I just ran across this dual carriageway without looking.
Well, we'll get the fluid started anyway, and then we'll reassess.
She's so independent. She will just get off her own back and go do things. She loves scuba diving. She went jumping out of a plane for charity. There's nothing that she will not try, and she's completely fearless.
Hey, Annie, always. Always busy. Morning, morning.
Connor, will you marry me?
No. Get on your hands and knees.
No.
I want to be swept off my feet.
The only word in the English language that contains all 5 vowels in the right order. Facetious.
Timothy.
"69-year-old Timothy has come into A&E after an accident on his bicycle.
Come through, sir.
Thank you.
Oh, dear. Come through.
He was training for a 100-mile charity ride when the accident happened.
Come and take a seat, my love.
Yeah.
Take a seat. My name is Ali. I'm one of the emergency nurse practitioners.
Thank you.
You've had a bit of a tate-a-tate with your bicycle, is that right?
Yeah, I went into the back of an ambulance.
Back of an ambulance?
Don't laugh.
Did they bring you?
Well, actually, they got another ambulance to bring me because they had someone in already.
Crikey.
They were just stupid.
Well, you know, accidents are never sensible.
Yeah.
Put it that way. OK. How are you feeling in yourself, besides stiff as a board?
Very, very stiff.
Getting stiffer.
I'm getting stiffer, yeah. Anyway, if I'm going to do it, going into the back of an ambulance is probably the best way.
Absolutely. Yep.
The accident was absolute stupidity. I was training for a bicycle ride I was going to do for charity, and I'd done about 40 or 50 miles. I was getting tired. I just had my head down, and then this ambulance, which was parked in front of me, I went into. I've got quite a lot of discomfort, kind of the left shoulder blade.
OK. So, I'm going to prod you. Right. Now then. So, let's see. Any pain here?
No. My shoulders took the whole of the shock. I don't think anything's broken there.
OK, that's cool.
Yeah.
No.
Having hit the ambulance, I then fell over. Okay. And the gear lever must have jammed into my finger as I fell and hit the ground.
Can you feel your index finger?
Yeah.
Yeah?
It's quite sore.
Okay. Sorry, darling.
It doesn't need stitches.
Oh, it will do. It'll need something.
Yeah. I've been bicycling in London since I was 10. And I used to bicycle up to Trafalgar Square and back. But there wasn't much traffic then, you see. And I was one of the very few people who bicycled to work in the late 70s, early 80s. Now, you know, lots of people do. And as I got older, instead of being the quickest on the road, I became the slowest on the road.
I'll put an injection on either side, put some local anaesthetic in there, and it will be numb as a...
OK, right, yeah. Between school and university, I cycled around Europe. I cycled up the Rhine, down the Danube, across the Alps. I was coming down to Venice, and it was a long day and it was raining, and I skidded into a kilometre stone, and that was the end of the bike.
Excellent.
I sent the bicycle home to my mother to claim the insurance, but unfortunately my postcard telling her didn't arrive in time, and so she opened the door to find this mangled bicycle without knowing what had happened to me. So I was told off for that, rightly so.
Blue sign down the bottom there.
Yeah.
When you get there, turn around to your left,
Yes.
immediately right, that's X-ray.
Okay.
Have the X-ray all the way back.
Okay, thanks. Well, to you, or to the waiting room?
Yes, please, no to me.
Okay.
Keep going.
Stop. It's so embarrassing. What do you look like? Connor, will you stop? Dear, I'm not, do you know, seriously. Get off me. Take it off.
Dad said that he wasn't going to get Mum a cake because she's on this diet. So I printed off some recipes. Okay. And the options are spiced plum and honey cake,
Wow, sounds delicious.
lime cake with orange blossom and pistachios,
Plum.
a lemony hazelnut and blueberry cake. I was thinking the plum.
Yeah, go for the plum, it sounds decent.
Orthopaedic surgeons have been called to assess the breaks in Michelle's arm and shoulder. Until doctors can rule out any injury to her neck, she'll need to stay in a neck brace to minimise the risk of any further damage.
What is hurting me more than anything is this collar around my neck because it is digging into my shoulder.
It's only because it's so important, those bones.
No, I can totally understand that.
OK,
someone's just panicking a bit.
It will be the worst pain they've ever felt, I'm sure. So pain relief is such a big part of treating a trauma patient.
All right, this is the morphine going in.
I can feel that going in.
Yeah, you will be able to. If I do it a bit slower like that, is it a bit nicer?
Yes, it is. Thank you. Does morphine work that quick, then?
When it goes in your vein, it does, yeah.
Oh, OK.
Patients do sometimes act a bit funny when they've had morphine. If you give morphine quickly and they're quite petite and they've never had it before, they can say funny things.
My next request, I suppose, is for a glass of Sauvignon Blanc.
Should we share that? That'd be nice.
I'll share a bottle, not a glass.
Yeah. Cool. All right, I'll get you your husband and your daughter.
Thank you.
Hey, Mumsy.
Hello, you two. Ah, hello, Pie. Hello, Pie. He actually looks quite clean.
I don't think it is.
Because some of us look after him.
He's mine. He's actually quite old. He's older than you. I met you when I was 20.
It was a joint decision to buy a motorbike or a car because I was all over the place, so it just made sense to get a bike. Most people progress into motorcycles. You start with a little one, usually commuting to work on a scooter or something like that, and then you progress to bigger and bigger bikes. Well, Michelle was going to go in at the deep end because she already had a car licence.
There's an earring somewhere.
I've got them in here.
No, you haven't. One of them's obviously fallen out. Rick, follow my eyes. There.
And how did the two of you meet?
That was a 1 in a million chance, I guess. I was a serving soldier at the time, so as the guys were going out on the town, my turn to drive, met 4 girls, And at the end of the night, I was dropping them all off, and I dropped Michelle off last.
I know you're worried. Calm down.
And she was in London, and I caught up with her at weekends. She worked for a firm who bought blocks of flight seats. And for the next 7, 8 months, we spent out in Portugal, Spain. I did the good thing and asked her dad if I could marry her, and he said, hurry up, please. The sooner the better. So then I asked her to marry me a couple of days later. I was shocked when she said yes.
You all right, darling?
So you still don't know if your neck's gonna be,
No, I did ask her to go and check. I said, because that's the thing that is most uncomfortable.
Have they given you a drink at all?
Over there, you bring the cup over with the gauze in it.
Yeah.
That's what they've been doing.
And then you just get to suck the gauze.
Yeah.
What are you doing? What are you
I'm trying to move my arm, all right? Please don't ask me what I'm doing.
I know you're uncomfortable, and if you want your arm lifted up, then I'll lift it for you.
I just don't know what I want, okay?
I can understand how people lose their partner and then just shrink back into themselves and disappear. When you're intertwined into somebody's life like that, it's like cutting you in half. We are a two-person team that do pretty much most things together, and it works. She is my world.
Thanks, darling.
Essential piece of information about
Ashley could do
nights on the
it.
emergency department.
I'm not going against Ashley because I'm.
You have to like
try and
move
move
without
and not laugh
without laughing.
and stare at each other in the face.
No, we need either side of a bed, and you look straight at the other person and move.
On your marks, get set, go.
You're supposed to not laugh. It's what you have to do.
Yeah, just not laugh.
Yeah, that's right, yeah.
Along here.
Oh, that's fine.
Fred, all the way to the end
Yeah,
to
that's
the
fine.
right.
Thank you.
On a push bike with the brakes, yeah. Rode into the back of an ambulance, as you do. It's got a cut all the way from here all the way round. Thank you. Oh,
hello.
lovely. Come through, sir.
69-year-old Timothy crashed into the back of an ambulance whilst training for a charity bike ride. His x-rays have revealed no broken bones,
Turn your hand over just so I can see the wound a bit better.
but he'll need stitches to close the wound in his hand.
So where were you off to today?
I was aiming to do a 100-mile ride in a month or so.
Oh, blimey.
So I was just doing some training for that.
So tomorrow you'll be a lot more sore than you are today, and the day after will be even worse.
I always wanted to do 100 miles when I was 70, and maybe once I'd done it, I won't want to do it again, but that's my target. But one has to recognise one is getting older. The last time I did 100 miles with two daughters, they were just about as tired as me that day, but the next day they were recovered, and it took me 2 or 3 days to recover.
You're all right there. You're all right there, darling.
Yeah, I mean, you dosed me up so much, you could be cutting it off and I wouldn't notice.
That's what we want to hear. Definitely.
It's not as though I've never been ill.
And these will just be taken out, won't they?
Yeah.
I had the kind of problems that men have with enlarged prostates, and I went to the doctor and he said, well, I don't think it's cancer, but we'll have a test. This was quite a long time ago now. The consultants weren't always user-friendly, and so I went in to see the consultant with the results of a test, and he said, well, what are we going to do about this cancer then?
There was part of that where the skin has gone. Okay.
I had an operation 6 weeks later, and I'd been free for almost 20 years. So I was very lucky. But there weren't many people one could talk to. And actually what was particularly important, particularly my wife, was the person who was most available and most prepared to talk was the Macmillan nurse. And my wife had a lot of conversations with her. And that was very helpful.
We are getting there.
That's all right. So I've been able to use that experience to help other people. I'm now retired, and I have 2 or 3 charities that I do things for. I'm trying to help raise money for a day centre for the elderly. And then usually once or twice a year, I do a long ride for charity. So how many stitches were there, just so I...
8 all in all.
Just so I know, I'd have 8 taken out.
Yes, absolutely. Keep it up as much as possible.
Yes, sure.
And that's about it, really.
OK, well, thank you so much.
You're very welcome.
Yep. So while I'm not going on it, I got a puncture. Oh, hello. Could I have a taxi, please, to the entrance to St George's Hospital from Blackhall Lane? I'll be with a bicycle, so if you can arrange a thing that I can take a bicycle. I'm at St George's, yeah.
I got up to the Lido one day.
You are?
I got up to the Lido one day. Paul, you know Paul in urgent care?
Yeah.
He said he goes up there in the week. He said there's no kids up there. He said it's really nice.
Oh, really?
You must be feeling quite claustrophobic.
It doesn't know any different, does it? It's never lived anywhere else.
Yeah, that's true. This is its normality.
I think it's about £6 to get in.
Just doesn't appeal to... Apparently the pool's always too cold.
It's just like, it's too...
You can see it.
Yeah. Oh, it's really stretching out.
Yeah.
Oh, it's weird, isn't it? It's all...
Yeah?
Must have moved its back, or maybe not.
It's sort of turned around.
It's like it's sort of...
It was sticking its bum out over here.
Yeah.
And now it's all...
The bum must be there.
33-year-old Eleanor has come to A&E with her sister Victoria after cutting her hand at home.
If you're induced on Friday, will you be overnight or just...
Just don't know, do you?
I always wanted to have children, actually. I always loved babies and friends, sisters and brothers.
Yeah.
Even when I was very little, sort of always loved playing with dolls, and I was always very upset that I was the youngest, and every day would come back and ask Mum when we could adopt another. I didn't mind what boy or girl, I just wanted to adopt. But being her fourth, I think she was definitely done by the time I came along.
I had bought these Cadbury's Pots of Joy. They're called Pot of Joy.
Nice.
I had both Pots of Joy.
Nice.
Last night, they were delicious.
So Vic, she works in a bookshop. She's a complete bookworm, and we're very different, but we still really get on. And she's a great sport.
Eleanor. Hello, good evening. My name is Stuart. Do come this way.
Did you take a seat there?
OK, we'll do.
And how can I help you?
Well, so I just went to move a bottle by the knives where they were. My husband's got a new meat cleaver that he had pointing away, but I just sort of pulled the bottle and it obviously just caught the edge of the knife and it was very sharp, so...
Would you like to lie on the couch and have a look at the wound?
I was just a bit stupid. Should I take my shoe?
It doesn't matter. I'm going to take this off first, okay?
Yeah.
OK, now, first of all, can you bring your thumb in? Can you bring it all the way out? Now, if I put my... Can you push against me?
Yeah.
Just push out. Lovely. And if can you push in?
Yeah.
Lovely. OK, if you turn your hand around, Anna, is that hurting at all?
No.
OK.
I have had a few other instances with my fingers. I did once cut my finger on cutting a frozen bagel and cutting my finger on a butternut squash.
OK.
I haven't actually touched a butternut squash. It's very dangerous. I actually know someone else who severed a nerve from cutting a butternut squash, so it's really, you have to be very careful. I am quite accident prone. I have to be very careful with knives, I think.
This will sting a little. I'm just going to look at the wound.
Can't be worse than childbirth.
Think of concrete.
Yeah, no.
OK. What we're going to do, Eleanor, I'm going to put a ring block in. I put 2 injections here at the base of your thumb to numb your thumb. That will sting a little.
Yeah.
I'll leave it 5 or a few minutes just to work its way up.
Yeah.
Then we'll clean the wound thoroughly and bring it together, OK?
It doesn't look too big. You'll have some scar. Oh, pop it.
It's fine. But I'm all right.
Don't want you fall asleep at work. Yeah.
Right, can you please stop having fun? I need the nurses in here to be professional, thank you.
In emergency nursing, you just don't know what's going to come in the door. It can change really quickly. You can all be having a really quiet day and then suddenly the phone will go off 3 times. Yeah. Hello, St George's. I think everyone's really good at just changing into the work mode and getting everything together.
Leads and the thrombolysis, they're coming in first.
When trauma patients come in, you can see how anxious they are. It's not easy just having your life turned upside down in one day. You have no idea that's going to happen, and then all of a sudden you're lying on your back in resus and you don't know what's happening.
It's hit her from the right-hand side, and she's tender all down her C-spine.
I like to be quite friendly to the patients and chat to them. I think that's the most important thing, really, to make them feel comfortable, because they're obviously in a scary situation. When it goes through?
It's just a bit... It's not hurting, it's uncomfortable.
Yeah, it is right on your joint.
But my wrist is still a bit painful.
Oh, okay.
It's been 8 hours since motorcyclist Michelle crashed into a lamppost on her way back from a rally on the Isle of Man. Orthopaedic doctors have arrived to discuss emergency surgery on her shoulder.
Okay, Michelle, so we're going to have to do a few things. The neck looks like a stable thing that will heal by itself.
Okay.
It's just a matter of probably whether you need a collar or no collar. That's the only thing we're waiting for.
Okay.
Okay. Regarding the shoulder, you do need an operation for it. The break going all the way from the head, and it looks like it's going down towards the main stem of the bone as well.
Yes.
Okay. We've got to fix, so you've got broken the 2 bones. So one is the arm itself, and you've also broken a bit of the socket as well.
Okay.
So we might need to put screws in both sides and a plate on the arm bone. Okay, so it's quite a big operation that we need to do for it. Yeah. The blade itself it's something that will heal absolutely fine, but it's more that the shoulder blade continues as being the cup of your shoulder joint. We're going to be doing the right shoulder. That's the main thing that we need to really fix.
If all goes well, do you know when I will be discharged?
Let's see how things go. It's more depending on your neck and depending on your breathing and things like that. Okay.
The medical team won't know until after the operation whether or not she'll regain full use of her arm and hand.
Do you mind just stepping outside? I'm going to do another blood test. Yeah. Thanks. Just, you can sit there if you want. It won't be long. Michelle, I'm just going to do some... I know you have blood tests in any other place, but because you're going for surgery here, we just need some bloods from here.
No, that's fine.
I'll be 5 minutes and then your family can come back in, OK?
Taking home, Mum.
I don't know why, but I don't worry with Dad. I think because he's always had motorbikes. But Mum, I don't know why. I just worried more about her. Every weekend in the summer, they're off somewhere. They're like over in Wales, or they're up in the mountains, or they're in the Lake District, and they've just gone somewhere on the motorbikes. She's wanted a lot of things in her life, and she's 100% been straight in there, the first person to go get it. She always has been like that.
Oh, yes, we got it.
There you go, well done.
It's just a bit slow.
Well done, you.
We've got friends as well that have bikes, and at some points there'd be like 12 bikes on the drive, and they would just all go off on motorbikes. Mum comes back beaming, and there's this just absolute smile. She's just so happy with herself. I like it. I like that they're completely out there and doing everything that they want to do and that they love.
So is that a yes or a no on the cost?
No cast. Just a sling. Yes. Good news. Fantastic. Thank you very much.
We'll get you a time for the clinic, OK? OK. Can I have a chocolate bar?
I haven't got the change, if your dad has. That's not that bad, is it?
Are you both, you and your husband, do you both like cooking?
He's the one who likes cooking, and he likes sharp knives to, you know... I'm more of the survival cook. He's the faffy, you know, plays around at the weekend.
33-year-old Eleanor is waiting for stitches in her hand after she cut her thumb on a meat cleaver.
OK, this will sting a little, OK? OK, now I'm going to leave you for a few minutes, Eleanor.
OK, thanks. Breathing is amazing, actually.
Breathing? Wow.
Could do with a little gas and air.
Yeah.
Wasn't offered that.
No. Save that for a week or so.
So I'm going to have to go through childbirth with stitches in my thumb. That wouldn't be very good in a water birth.
Yeah, they'll put a bit of plastic over it. They'll make it waterproof, don't worry.
When I was little, I had two sisters. I was probably more similar to Pen in that we, you know, liked sort of more fashion, and whereas Vic's more of a bookworm. My other sister, Penelope, she was diagnosed about a year before with cancer. We knew she was very ill. But she was amazing. She sort of, you know, lived life to the full till the end. She was only 45, very young. Yeah, so, yeah, you know, tough times. But she was an amazing woman. She makes me live my life.
Don't look at it.
Can you feel anything?
No, it just feels tingly. This knife, I mean, is seriously Japanese cleaver. The thing is, he said he'll do sushi, and so I was like, OK, well, you can have some knives if you make me sushi. But I bet he'll never make sushi with it. How? Oh, the baby's moving. Ooh.
Baby moving.
Oh,
It's distracting you.
it's real proper, like. How many days did you say to have them out? 7 to 10.
7 to 10.
Oh, so I could actually have them next Thursday, maybe.
You could,
Because I should be able to get it wet next Friday, maybe.
Absolutely, yeah.
If I want a water.
No, it's not really.
Thank you very much.
Be that much nicer.
I'm never going to look at this knife in the same way.
Yeah.
I certainly would never, ever use it.
I wouldn't even know when to use it. I suppose on meat.
And when you touch it, is it painful?
Yes.
Yeah?
Very painful.
Shut your eyes tight. I'm gonna try to open it. Don't let me do it. Okay.
Okay, sorry.
I'm sorry. That's okay.
Biggest the morphine.
Over there is my TT shirt. I can throw everything else away. My TT T-shirt. I asked for it to be saved.
OK, it might be cut off. We'll have a look at it, John.
Thank you.
The full results of 50-year-old Michelle's CT scan show no damage to the bones in her spine.
Yay! Look at me, I've got it off. Oh, I've got to have the other bit of morphine in as well.
My wash bag's in there with your cleanser, your toner, half a packet of cotton wool pads and your toothbrush. And some toothpaste.
Fab. Thanks, darling.
Is that your teddy?
I had that as a leaving present for one of my first jobs.
Did you?
One of the leaving presents. 32
Thanks.
years up, Poe.
Poe?
Yeah.
As in polar bear?
As in polar bear. Yeah. I was very imaginative when I was 18.
I have a monkey called Monkey.
Yeah, there you go.
So I was 4.
When you go speak to them, that's when you've got to get out of your nursing assessment mode and just see them as a patient that's had a horrible accident and put yourself in their shoes and understand how they'd feel. Because at the beginning, you're thinking about so much that you can't really think about that. You don't want to miss anything. And then when that's all died down a bit, then you go see that patient as a person, and that's when it really hits home, like, how much that person's life has changed.
We're going to go up to a ward called Gunning Ward, so you don't want to come.
Yeah.
And then you'll have to go home after you've settled her in. And you can come back tomorrow. It's the 5th floor of St James's Wing. So this is St James's Wing, so you go up to the 5th floor.
5th floor, St James' Wing.
All right?
It's my surrogate daughter.
Michelle will be taken to a specialist ward where she'll be monitored over the next few days.
He was born 7 minutes after 12. So he's called Wilfred Toby Lindell. Toby was one of my sister's favourite names. Yeah, she left a real legacy. It makes me sort of live my life, because it brings it home that actually we're so vulnerable, I think. Yeah, enjoy life while you can, every minute.
I just thought that I'd broken a bone. It looks like a garden rake has been planted in my arm. I can't put my hair up in a ponytail. I can't put my hair up in a clip. I have to get someone to do that for me.
I'm split between never wanting her to step on a motorbike again, to ever go near one. But then I think if it makes her happy, you just got to let her get on and do it.
I've promised my mother that I would never go on a motorbike again, and I've promised a lot of my friends that I would never go on a motorbike again, but we've already got the ferry booked for the Isle of Man next year. So maybe, just once more, maybe I'll just go on the back of Rick rather than take my bike. Maybe that's a compromise I can do.
To be or not to be, that is the question. To die, to sleep no more. Oh.
I've fallen down the stairs and I've broken my leg so badly the bone's sticking out.
St George's Recess.
Open dislocation left ankle. More often than you think, you see patients coming on their own.
The plan is to correct the angulation of this fracture.
It's the worst moments of your life when you come into hospital, and I wouldn't want anybody to be alone.